And I'm gonna share screen. Here, just a sec. Okay. Okay, so I'm sharing this screen. Share and put it in present. Alana, you are my eyes and ears. So give me a thumbs up if you can see the screen and if you can see me and hear me. Yeah, awesome. All right, let's bring this here. Okay, just let me see if I can do it this way. Perfect. All right, so today we're going to talk about different ways. First we'll start by talking about the back problems in general, understand why they are happening, and then we can move on to possibly some tips on how you can manage them effectively. But if we don't know what we are working with, then it's not so easy to solve the problem. It's best to first understand what the problem is in itself, and then we can start solving it as well. So moving on. So I'm going to start with my story. I've been a physical therapist for a long time, for over 10 years. I've practiced in the states of New York and Virginia, and I specialize in this system called as the Mckenzie method. And that's where my passion to help people to empower themselves to get better and help them avoid painkillers, injections, and surgeries in the long run started. So that's kind of been my mission. As I've been growing, my business and also been helping patients all over to help solve this problem of, not just back pain, sciatica, but also shoulder pain, knee pain, hip pain, any type of musculoskeletal problems. So I've been lucky enough to meet so many wonderful people, across while I have been kind of developing and building on this journey. Okay, so I started my business, Health Watchers, about 2.5 to 3 years ago. And my main goal, my main mission was to help people, help them avoid painkillers, injections, and surgeries for their musculoskeletal orthopedic problems. Not to say that injections and surgeries are not, they should be completely thrown out. Yes, they have a time and a place, but they are not always essential. And there is a lot of research that is coming out that talks about how these things are being overly prescribed because people don't get the right care, the right attention that they need early on. So if we can tackle these problems early on, if we can tackle them the right way, we can definitely minimize the need for these types of invasive procedures. And of course, there are a few small number of people who do require these invasive procedures as well. And for them, we are happy to refer them out. But our bigger picture goal is to empower everyone else and these people as well post surgeries to, help them get their health back, get their active lifestyle back, which is the most important thing.
Taruna, sorry to interrupt. I cannot see the screen, the presentation.
Okay, let me see. I'm going to stop share and share again. Share. Yeah, thanks for letting me know because we would have gone the whole presentation. Where did this go? Oops, technical. Okay, so this is back. And now I can do a screen share now. Okay, can you see it now?
Yep.
Okay, good. See and hear me?
Yep.
Good, awesome. Thanks for the feedback, Eric. All right, so we're going to start with some interesting facts about back problems. So, research has shown that almost 80% of adults will experience some sort of back pain at least once in their lifetime. And I personally feel it should even be a little more. And the reason that I'm sharing this statistic today is I know a lot of people who go through these problems, and I know that because I talk to so many of them one on one, is because they feel so lonely and so isolated in going through these problems. But the fact is, it's majority of the world. In fact, if you do not have an issue like this, you are a rare minority. The more and more people are experiencing some type of back pain, some type of backache and neck pain or sciatica at some point in their life. So you are definitely and certainly not alone. That's the good side of the picture. And also the good side of the picture is that there's a lot of help available out there. There's a lot of research available out there that can help you solve this problem. Another big important thing that comes out from the research is that people who have had back pain once, the chances of them experiencing it again at some point in their life is extremely high. Now this is not a good information on the surface, but because we know this as a fact, we know this from research, we can empower you by making lifestyle changes so you make sure that it does not happen again. So that's the value in that information. So that's why when we see people in the clinic or people that I mostly work with, we focus on making lifestyle changes instead of doing some one and done thing that's just going to solve your problem for once, but a year later, 2 years later, you find yourself back in the same cycle. That's never going to work. It's always best to make lifestyle changes and long-term changes in order to make these types of solutions stick. And because of all this, of course, the healthcare cost for back pain is in fact one of the most expensive healthcare cost in the country. Well, that's probably changed now with the pandemic, but that was the case a few months ago. So I'm not gonna bore you guys a lot with the nitty-gritty details of the anatomy, but we'll just go through the basics so you kind of understand how your body functions and how the spine is structured. So as you can see here, your spine is like a complete ladder. It starts all the way up from your neck, from over here, and then it extends all the way down. This is your tailbone or the sacrum. So this portion of your spine, the neck portion, that's your neck or the cervical spine. Then you have your middle back or the thoracic spine. Then you have your lower back or the lumbar spine, as is commonly known. And then you have your tailbone or the sacrum and the coccyx. So as you can see, everything is attached to each other, and that's exactly how it functions, like one ladder. Typically, once you start having problems or issues in one part of the spine, the chances, of it, the longer that problem stays, the chances of that problem going further down or impacting the other units below it are extremely high, because they're kind of interdependent on each other for everything that we do for our day-to-day activities. So it's good to know that all these things kind of function as one unit. They're all together in this. Now inside your spine too, so this is like one zoom portion of your spine, and I can show it to you here as well. So these are the two vertebrae. You have these two bones in the spine. If you zoom them, each separate unit is called a vertebrae. And then you have a jelly-like structure in between, which is called as the disc, the intervertebral disc. Now, the good thing about the disc is it is literally like a jelly. It's squeezable like this. So you can think of this one unit as a stack of jelly donuts. So this is a donut, this is another donut, and this is your jelly in between. So because this disc is almost like a jelly, our ability to work with it and move it around is extremely high, which is a really good thing, which is what makes these problems so treatable without having to require any type of invasive procedures for the most part. So your body is uniquely designed that way, so it can heal itself by given the right environment, the right movements on its own. More often than not, it doesn't require all these extra external things to kind of heal itself. And then if you look at this particular picture, so this is sort of like your disc in itself in isolation. So your disc has this outer ring called as the annulus, and it has this central portion called as the nucleus. And a lot of times when you hear about the herniating and the bulging discs, it has a lot to do with this portion of the disc. And also the role of your disc is to act as a shock absorber. When you're walking around, when you're moving around, your disc tends to absorb a lot of shock and a lot of stress on your spine. All right, so on to the next one. So your spine kind of goes through different movements. One of the movements is obviously the forward bending or the flexion, and the backward bending or the extension. These are the two most common movements that happen in your spine. As you can see, the flexion or the forward bend here, which is the movement that you do when you try to touch your toes. This is what's happening at the disc level and the spine level. Each disc vertebra by vertebra is bending forward, and this is the movement that's taking place. And then when you do the opposite movement or extension or the backward bend, this is what happens. Vertebra by vertebra, this is what's happening with the backward bend. So as you can see, your disc is also moving along with your vertebrae. When you bend forward, the jelly tends to move in this direction, in the posterior direction. And then when you move backwards, the jelly moves a little bit in the opposite direction. So a lot of times we don't think about our spine moving when we do these movements. We tend to focus on our muscles. We tend to focus on which muscle feels tight and which muscle feels loose, and where do we have trigger points. But really a lot's happening inside your spine as well. And it's good to know what's happening at the spinal level, because that's really how we treat and look at these types of problems. And then, of course, the less common side-to-side movements of your spine is when your spine is going, this way and this way. So when you do the side-to-side movements, this is what's happening at the spinal level. All right. So like I said, I'm not going to spend a lot of time on the anatomy because I know it can get boring really fast. This was just to kind of give you like a basic overview of what's happening. So once we talk about the more real life, more practical things, what a disc is, or what a lumbar spine is, and what a tailbone is. So you can, be more better informed when you read your MRIs, when someone tells you you have this problem or that problem, you know what they are talking about. All right, so the next part of the presentation, we're gonna talk about something that you hear a lot. You read about this in the blogs, you see it on social media, it's everywhere these days. There are thousands of postural products that are being sold to you, and all of them talk about posture. So what do you exactly mean by posture? So posture means the position in which your body falls when you are in a particular position. So if you are in sitting, the position that your spine adopts or your joints adopt is called as the posture. So this will also apply to when you are standing. The position that your spine adopts is what is called as the posture. So, very commonly, just by the nature of things, just because we are humans, because of gravity, we all tend to fall in very poor postures unless someone advises us or gives us the right direction to follow those movements. And we will talk about what ideal postures are, because it is different for every individual person. There is no one size fits all. But I just wanted to talk about what the word posture itself means, So next time when you hear the word posture, you really understand, because sometimes you don't really understand what it means, but you hear a lot of information about it. So what the reason why posture is also really important is because we spend a good portion of our day in one position. So a lot of people who have sitting jobs spend a good portion of their day in sitting, and they are in that one position all day for hours, days, weeks, and years. People who are standing and doing physical labor type of jobs, they are in those awkward positions all day for days, weeks, hours, and just being in one position all day. So say if my job is to sit all day and I'm working on the computer, and if I'm in a slouched posture, this is how my spine is. So my spine is stuck like this for hours, days, weeks, and your joints are not designed to be stuck in that one position for so long. They are designed by nature to be moving around from time to time. So that's where the problem starts. The problem starts when we don't give our joints what they are designed to be doing. So you've heard me talk about Mckenzie method, MDT. That's what I specialize in. And it's very confusing for people to understand the difference between physical therapy, Mckenzie method, and things like that. So I'm going to try to clarify some of that for you. So what is Mckenzie method or MDT? Mckenzie method is a specialization within physical therapy. And what this specialization entails is that we look at your joints and your body and especially your spine a little differently, because we look at your movements, we look at your different activities, and we assess you based on that. And what it means for you is that it helps us get to the root cause of the problem instead of treating the symptom itself. That's the best way I can describe it. So a lot of times you might go to someone, and if you have, say, pain in your knee, the typical response would be to start looking at your knee, start moving the knee around, and see you, and kind of start treating it at that level. But how we work with Mckenzie method is we start by examining you thoroughly all the way up from your spine and then down to your knee, and try to find out what's exactly going wrong where, to start creating that knee problem. And once we find out the root cause of that knee problem, whether it's coming from the spine, whether it's coming from your SI joints, whether it's coming from the knee joint itself, then we treat that root cause and try to fix the problem. A common example I give to patients when explaining this is, say if you have fever and you go to your doctor for the treatment of fever, you would like your doctor to assess what's really causing the fever, rather than just giving you something that will just reduce your fever for time being, because that's not going to last. So that's exactly what we try to do, is we try to move you around, and using the process that we use, we try to solve the root cause instead of the symptom itself. And that's why the process takes a little longer sometimes, not always, but sometimes it could take a little longer. But the good thing is that it gets you to the permanent solution instead of giving you a short-term fix or a band-aid. And it also empowers you, because you understand what's wrong, what the problem is, so you can understand and kind of help yourself as well, instead of being completely dependent on your provider or anyone else for that matter. Also, there is no one size fits all. That's one of the biggest things I tell people, because every person is so unique and so different. There are people who fall in certain categories, like 80% of people might benefit from this, 20% might benefit from that, 1% might benefit from this, but you don't know in which category you fall into unless you get the assessment for yourself. And sometimes you can be in the gray area, you can be a little bit here, a little bit there, but it's always best to get your own assessment and to understand your own problem and solve it in that unique way that you are, instead of kind of going for the herd approach. And of course, it has a lot of research. to support its value. So that's what another thing that separates it from a lot of other, conservative treatment interventions that are out there. So let's dive into some of the very common causes of low back pain. So poor sitting posture, that's been, like I said, it's one of the biggest reasons. The sedentary lifestyle these days, as you can see this gentleman over here, he's spending several hours a day working on his computer. His lower back is a little slouched. His upper back is a little slouched. His neck is sort of slouched as well. He has what we call as a forward head posture, like his chin is sticking out as he's trying to focus on the computer screen. And this whole positioning in itself is not a good positioning for the spine. And that's, if he continues to stay in this posture, it is only a matter of time that he's going to start having these types of aches and pains. So this is one of the most common reasons, especially in today's lifestyle, for these types of problems. Then came the advent of standing desks, and more companies started to offer people standing desks. There are many and many in the market. And although they are a better option than sitting desk itself, if your standing desk is not set up ideally, that could be a problem as well. So for example, in this instance, this gentleman's standing desk is way lower than his height. He's a tall guy and his standing desk is all the way over here. As a result of that, his lower back is sort of not in the optimal position. His hips are kind of just hanging loosely there. More importantly, his upper back has to be slouched because his screen is, kind of not at eye level and he has to look down. And the same thing is happening with his neck and cervical spine because he has to look down. He's not as bad as the guy before, but he's not in an optimal position either. So he is not in an, ergonomically ideal posture either because his spine is all in a weird position just because of a simple problem of his desk not being adjusted to the right height. So just by knowing these few things, you can make daily adjustments in the postures and positions in which you work, and that can help decrease the risk of these types of problems significantly as well. So with the whole new quarantine thing, I think people are falling into two groups. There is one group of people who have gotten more active and they have more time, so they are investing in their health, and that's been helping them, which is great. But unfortunately, that's a smaller number of people. Majority of people are looking like this. They don't have the best ergonomic setups at home, as this lady, trying to modify things at work to kind of give themselves ideal positions. They have kids jumping in the background while they are trying to get things done, and they are running around with their kids more than ever. That's giving them new aches and pains. People are doing more household chores than ever, bending, stooping forward and kind of emptying the dishwasher. I was just talking about that yesterday to someone, and just being in that forward bent position to empty the dishwasher. And if that's something that you're doing more often now because you're cooking more, you're making more meals at home, that in itself could be a recipe to start some low back pain, coupled with a poor posture for your computer time, or a poor posture for when you're watching more TV or watching more Netflix because we are not going out as much. So, simple things like that. Not to mention, everyone is in more stress these days. People are giving in to the depression and the anxiety that's coming along with this whole situation. People are getting into emotional and stress eating, and that's not helping them either. So it's an array of multiple factors that's causing people to, fall into this back, neck, shoulder problems even more than before. So this is a problem that we don't come across so often in the last couple months, but it's only a matter of time that we will be back to our normal lives, and it will be back again. just being in long flights and not having the best posture in the flight. So as you can see, I tucked in my little lumbar roll over here to give myself better positioning in the spine. But if I didn't have this lumbar roll, my spine would be in a slouched posture, sitting in that flight for 8 to 10 hours. Remember, before and after the flight, you carry heavy suitcases, you lug them around, you walk around airports carrying those heavy suitcases, the bending and lifting. So especially long duration flights could be a easy trigger for your back pain episodes as well, because it's a whole combination of everything. It's the heavy lifting, then sitting in that awkward and poor posture, and then heavy lifting after again. Improper lifting and shoveling. Again, this is not so much right at the moment, but this principle also applies to the whole dishwasher thing that I was talking about. If you're bending forward, stooped, by losing the curvature of your spine, like here, and if you stay in that position for too long, and then the bending and the twisting after, that could easily be a source of stress for your back pain and your sciatica symptoms. So symptoms of spinal problems. So many people have issues with their back and they don't even know they have it. And the reason for that is the symptoms that come from your spinal problems, they can be so varied that sometimes it's hard to even know that you have some issues coming from your spine. So what are the common examples of that? Common example of that would be some people might just have morning stiffness and nothing else. They might just start losing their ability to walk gradually. People come to me and they would be like, I used to be able to walk 5 to 6 miles at the very least, and now I walk a mile and I get tired, and that's just because their legs are gradually getting weaker. The same would apply to runners. They start to lose their tolerance to running gradually over a period of time. And all these things could be coming from your spine, and hence an assessment is always handy to kind of find out what's really causing these problems. Morning stiffness and pain, that's another big one. It's a very common symptom in people who have spinal issues. They experience their symptoms much more magnified in the morning. But again, like I said, it's no one size fits all. This is something that majority of people go through, but not everyone goes through. And that's just because your discs are in a high pressure state in the morning than later in the day. So this is how your disc looks like, and the jelly-like cushion over here. So this disc over here is because it's in such a high pressure state in the mornings, it absorbs the fluid at nights. It's all thick and stiff, and that's why you feel the aches and pains in the morning, versus later on in the day when you move around, the disc loses some of its fluid and now it has much more mobility and it doesn't hurt as much. So again, if you experience your symptoms, especially just in the mornings, you are not alone. It's a very common phenomena that happens in people with spinal issues. And if you would like to read more about this topic, you can actually read it in one of our blog posts here, which is called "Why Does My Back Feel Stiff in the Mornings?" If you kind of go through that and if you want to dive into the details of it. All right, how can we help? I'm going to take a water break. Okay, so every back pain is different. If there's one thing you guys can take from this presentation, it should be there is no one size fits all, and every back pain is different. It's unique in its own way. And that's because everyone's spine is so uniquely designed, because of the history that you have, the way your posture is, the way your lifestyle is, how active you've been, how active you want to get, what your specific goals are. So because of that, every spine is so unique, and it's best to treat the spine with its own unique, treatment, by assessing you, finding the root cause, and giving you a treatment accordingly. Common example I give to patients is, if you go to a doctor, you want that specific pill for your specific problem. You don't want them to pick out anything random, from their pill racket and just give it to you without even knowing what your problem is. And that's what happens when so many people follow random exercises from YouTube, because that's what it is. It's like a CVS. You don't want to go to CVS, pick out a random pill without even knowing what your problem is, and just bring it home and try to take it. You want to know the specific problem, and a specific solution will just do the trick. So how does Mckenzie method work in your specific back situation? Like we talked about, process of assessment, we find out what the root cause of your problem is. And then depending on what the problem is, once we know what the problem is, it's very easy to find the solution. And that's what makes it a special, unique method that we use for treating your back issues. So I'm going to give you guys a few minutes, and I'm going to play this video about Mckenzie method, just because I think it gives you a real good idea of how it works. And it was featured on Good Morning America. And I think it's highly beneficial, and it's just kind of put things more into perspective.
He cannot hear it.
Taruna, we can't hear that.
Can you hear it now? Can you hear it?
Barely. The volume needs to be turned up.
Sometimes searing back trouble.
I guess for the last 10
And can you start it from the beginning?
He's tried acupuncture, visiting a chiropractor.
10
Searing back. Sabnani has
called the Mckenzie method. Take a look.
with the Sabnani has persistent, aching, sometimes searing back trouble.
I guess for the last 10, 15 years, it would come on and off.
He's tried acupuncture, visiting a chiropractor, even hanging upside down. But now he's trying something new. It's called the Mckenzie method. It's a form of physical therapy where diagnosis is based on conversations, not x-rays or MRIs. Treatment focuses on posture and almost counterintuitive stretches. And the patient takes control while the therapist acts like a consultant.
I avoid flexing forward, so I think bending forward is the biggest thing. Avoid sitting. Anything that compresses the spine, you want to avoid that. So constantly reminding yourself to stand tall.
So I visit Wickes' Mckenzie practitioner, Steve Mangiello, and work with him on my aching back.
I like to think of it as patient empowerment through cause and effect. So we do this movement, it makes you better. We do this movement, it makes you worse. Bend forward, down towards your toes.
An offhand remark about when I experienced some relief gives Steve a clue.
You mentioned something about how you like to lie on your stomach in bed, and that usually makes you feel better. And walking and standing, everything upright makes you feel okay. So that tells me that we have probably a sitting issue. Like that.
Since Mckenzie asserts that patients intuitively have the knowledge to self-diagnose and even treat themselves with a little guidance, Steve seizes on this.
You feel any pain with that? Back down.
It's just that good stretching feeling.
Instead of stretching into the pain, he says stretch into the relief. And while there may be times where more aggressive medicine is needed,
I feel like you're letting me, the patient, be your manual for how to treat me.
Yeah, it's your body. I'm just trying to understand how it moves.
new relief for this old body. For Good Morning America, Becky Worley, Oakland, California.
Well, hey there, GMA fans.
Okay, I hope you heard that video well. If not, I'll send you the link of that YouTube video again so you can watch it later on if you wanted to see it, again properly. But yeah, I hope that video kind of gives you a good idea Like I was talking about, using your movements and positions and kind of using those to just trying to make this go away, using those to help guide your symptoms and treat you accordingly instead of just solving the problem that we see initially. Not just the symptom, the root cause, the big picture, the whole picture. Now, this is again a concept that some people experience. It's experienced by about 50 to 60% of people who have low back and sciatica symptoms. So there might be a good 40% of people who may never encounter this. But what is centralization? So if you are someone who has symptoms going down, let's see. Yeah. If you are someone who has symptoms going down the leg, that is, if you have leg pain and sciatica symptoms, as you are going through the right movements and right treatments, you can experience your symptoms to go back upward in this direction. And that's what's called as centralization. And as you're going through this process, you can also experience a temporary increase in your symptoms around the lower back and the buttock area, which is in fact a good sign. So when people are going through it, it's very hard to fathom that this is something good that's happening to their body. And I get it, because all of a sudden you have this new increased pain in this portion of your spine that you never had before. And it makes you wonder if things are healing the right way, if what you're doing is right, is beneficial, and is helping you. But it actually is. But it's always best to keep talking to your provider, and as long as that pain is within reason, it's a good sign. But of course, always talk to your provider and consult while you're going through this phase. But just to let you know, this is something we expect, and this is something that has a lot of research supporting its validity. So that's a great thing. So because Mckenzie method uses your movements and it kind of empowers you to take charge of your own health, it's based so much on assessing you the right way and kind of treating you based on your movements, assessments, postures, and things like that. It has a huge amount of success, even when we see patients remotely and through video. And that's one of the things. We also see a lot of patients through what we call as telehealth or through video sessions. So we, if of course the quarantine is definitely a big reason why we use our video sessions or why we use telehealth. But even long before the quarantine, when we have people who live several miles away from us, people who live not too close to us and who are looking to sort of actively get their bodies to heal and get back to their previously active lifestyle, more often than not, Mckenzie method works very well through videos as well. So I'm going to share the story of this young gentleman who started working with me last year, and he had seen several other providers before he started working with me, and he didn't have much of a relief. Not sure why, but anyway, he lived about 80 miles away from my clinic, so it was really hard for him to come for the regular in-person visits, and that's why we started treating him through video. And then 3 months later, he's not only pain-free, he does have little bit aches and pains that he knows how to manage himself. But most importantly, he's back to his active lifestyle that he had completely given up when he first started working with us, which was the most important thing. He's a young kid. He likes playing sports. He has a very active lifestyle, and getting him back to his active lifestyle is what what we call as a real success with these types of treatments. Okay, so I'm gonna play this video as well. See if you can watch that.
Well, before I started, basically I had back pain for over a year, and it really limited my ability to do basically anything that I wanted to. I was a very active person before I started having back problems. And that was all stemmed from some pretty questionable lifting decisions, personally and with work. And so since then, basically anytime I tried to play a sport or even like really work out, I just kind of had like back pain at like a 5 or 6 out of 10. You know, it really wasn't that pleasant. So yeah, things have genuinely gotten a lot better. Like I'm starting to get a lot of aspects of my life back. Like,
Oops.
like personally and with work.
Having a bad technical day today.
A lot of aspects of my life back. Like a couple months ago, I didn't think I'd be able to run, and now I can run like a 5K. I've started playing soccer and sports social.
Okay, I'm going to take a pause from that video. Sorry guys, it's not technically the best day for me. Just a sec. Wow. Stop share, and I'm going to share screen again and see if we can get it that way. And yeah. And go to present. Okay. All right, so again, this video too, I'll probably send it to you guys if you want to watch it in full. Having some technical difficulty, I guess, playing the YouTube video in the presentation. But again, we have been using Mckenzie method can be used very well for active management of your back or spinal problems and spinal pain. As you can see of this young gentleman in the video as well, doing his active exercises. And the reason I'm studying this, sharing these case studies is because sometimes it's good to see in visual that other people are going through the same thing and they have been using active movements, active techniques to self-manage their problems. So it's at least worth a while for you as well, if you haven't given these types of treatment a chance, to at least give them a chance and see if it, you know, works for you before discounting them completely and kind of putting yourself in a position where you start to believe that nothing can be done. So your health is, you know, your biggest investment that you can make. You don't want to discount that or take it for granted. So this gentleman over here, he's kind of working through his knee program for the Mckenzie method through our video sessions. And he kind of started with a stiff and painful knee as well, with the goal of being able to get back to running his marathons, living in New York City. And he's not quite there yet, but he's definitely very, very close in working through his movements and exercises to get through that. So it's very hard to imagine that how he can work through all of this remotely without even being in the same room as his physical therapist or Mckenzie method specialist is, but it can be done because, again, assessing the movements and guiding them through those treatments. Another case study, and this case study of this gentleman is someone who was coming to our office in person. When he came to us, he gave us his permission, of course, to share his case study and video with others. And when he first came in, he was diagnosed with a herniated disc at L4, L5. He had been to another physical therapy office. He had tried dry needling, injections, as he told us, and he was really considering a spinal surgery in the next 3 months. And trying Mckenzie method was his last option, recommended to him by his wives, who turn out to be almost always right. He's a very active guy, so he was missing out on running, playing basketball with his son, being active. He had a lot of fear associated that he would never be able to return to doing those things again with his kids, which meant, which were extremely important for him. But lucky for him, by the time he completed about 8 weeks with us, he was not only pain-free, he had, not taken any painkillers, no injections. He canceled his surgery, but he is now back to running and playing basketball again with his son, and he's enjoying his very active lifestyle. Most important thing, he was able to avoid that dreaded spinal surgery that he never wanted to have. So I have his I'm not gonna play his video because I don't think the volume's working very well, but again, I'll probably attach it in some sort of notes in an email. So all these videos are available on our YouTube channel, so you guys can watch them later if you wish to. So like I say, movement is medicine when it comes to Mckenzie method. Our job is to identify and let you know which is the right pill for you so you can take it in the right amount and the right dosage. It's as simple as that. What are the different ways you can work with me? If you're not an existing patient or an existing customer, you can do one-on-one video visits. Because like I said, there's no one size fits all. You want to get your assessment in and understand what's really causing your problem, and then get the treatment accordingly. Once we know what the problem is, the treatment part is actually really simple. Option number 2 is to come in for an in-person visit at our office. We are taking very limited to none in-person visits at this time. We'll be opening up soon, very, very soon, for more in-person visits, but this is definitely an option for those of you who live nearby in the Reston area. And we can, at this time, we can hop on a, if you have the opportunity to book sort of a 15-minute Zoom call to talk specifically about your problem and see which option is best for you, whether you want to work through video or you want to come in for an in-person session in the clinic, and which one's going to best suit your needs and your problems specifically. In the meantime, if you are not ready to start addressing your back issues, you can definitely subscribe to our YouTube channel, follow us on Instagram, so you can get all these free educational resources to at least learn more about your problem and try to manage it the best you can on your own. All right, so I'm gonna minimize this screen and stop sharing. Awesome. All right, so any questions from you guys that you want to ask openly for the group? Okay, I know a few of you had some more private questions, and we can probably talk about those in the chat, or we can book sort of a one-on-one Zoom call later for those questions. But yeah, I understand some topics can be personal, and you don't necessarily want to talk about those in the group, and that's totally fine. But I wanted to thank you guys for coming in today, for spending your hour with me on a Saturday afternoon, and hope you guys found it valuable. And what I'll do is I'll put in those videos in an email for you guys, because I was having some technical issues. I'm not that great, I guess, with the technical stuff. But you can watch those videos easily on YouTube from the comfort of your home. And if you have any questions, you're more than welcome to reach out to me, and we can take it from there. Awesome. All right. So